You guys, please, what's going on in this part of the world? I'm I'm concerned. Why is it so difficult for health workers, especially the females, to be regarded as what they truly are? Like, I'm coming from the point of a medical doctor called all sorts of things. So in this short span of my career, I've been called a lot. Auxiliary nurse, auntie, sister. So something happened at my workplace. The patient that my colleague had seen came back into the consulting room to ask me for something, and he was trying to refer to her, and he called her that girl. And then I'm just like, that girl. He just entered like, hey, where that girl? Where see me now? In my head, I'm like, that girl. Who is the girl? Who is lost? And I say, that girl, sit down for there. She thought, say, make I go do test for lab. I said, sorry, oh, it cannot be the doctor that just saw you now. You told her all your complaints. She asked, she clerked you, she examined you, she asked you to go and do investigations, and you still cannot refer to her as the doctor that just saw you now. What do you mean by that girl? So I asked him, I said, sir, what do you mean by that girl? Who is that girl? And I said, what did he even say, safe? And I said, me, I don't know that girl, though. Maybe if you go and try to confirm who the person is. And I said, okay, sorry, that doctor. In my head, I'm like, so you can refer to her as doctor. So why did you call her that girl before? Sometimes you will even be wearing like doctor or nurse. They will still choose to call you something else that is so. What sister? What the hell is sister? What do you mean by auntie? Some people even call you mommy. Hey, people are going through a lot. People are going through a lot too. Sometimes I don't vex, I don't parable. Some people are now always very rude about it, because even when you correct them, I remember that patient that called me an auxiliary nurse, and his mom was correcting him and saying that how can he call a doctor that went to school for 8 years an auxiliary nurse? She didn't even call her a nurse, she called her an auxiliary. And I said, can females be doctors? So I think it's actually an ignorance something, because it's not Oshemini Kayefi. Some people will not still be vexing on top. You still be correcting them, they will still turn it to vex matter. Are you a mumu? Maybe people should enlighten me, or like, how is it going for you guys, or is it a size thing? Because I know I'm not on the Firigbon side, so maybe that's why. Maybe because I'm short, and maybe sometimes people can't believe it, that they can't fathom it, that I don't know how to treat them. Maybe sure. But even at that, like, if it was a short male doctor, would you call him uncle or brother or that boy? Or is it a gender thing? I really just want to know, to be very honest. I really just want to know. Like, people need to do better, to be honest. I mean, like, we're not well paid. We're not exactly getting benefits for this job we are doing. The least people can just do for us is to call us, our appropriate titles, and not auntie us or that girl us.